So we're now going to look at the scapula and the pecs. And so if we draw kind of like what the scapula looks like, it's kind of a interesting disc looking bone. And so this is kind of what the scapula looks like. And we have the different parts of the scapula where right here is the infraspinous spinous fossa. We have the supraspinous fossa right here, which is basically right around here. Here's where the subscapular notch fits in, the acromion. The glenoid fossa is right here, and then this area right here is called the spine. And this is basically right here is where we're going to see the rhomboids attach, and actually it's down here where the rhomboids attach, and then the levator scapularis muscles are going to attach here. So if we look at that, now if we think about the other muscles that attach, so I said on this side it's the rhomboids, the traps, and levator. And what's going to happen when we're going to have one of these muscles pull at the scapula, it's going to cause retraction. So this results in retraction when these muscles pull. And this, another way to look at that is it's abduction or adduction, sorry. And so the way you can think about what adduction means in terms of this, if we were to look at somebody and they're retracting that muscle, it's kind of like doing basically rows. So the two scapula are going to kind of fold inside or go towards the spine, and your shoulders are going to be more back. Now, if we do the opposite movement with retraction, which would be going this way, this is also abduction. This is rolling your shoulders forward, and the muscles involved with that are the serratus anterior and the pecs minor. Now, if we were to roll the shoulders up, the muscles involved are going to be your traps, your serratus anterior, and your rhomboids. Now if we're going to roll them down, so basically we're kind of rolling our arms down, what these muscles are going to be, it's going to be your pecs minor, your rhomboids, and your levator. Now if we wanted to depress the scapula, so it's kind of like when your shoulders are slouching, the muscles that are going to be doing that are the traps and the pec minor. And then if we're going to elevate the shoulders, or I should say the scapula, this is like if you're doing a shoulder shrug, your rhomboids are going to be involved, your traps, and your levator. So these are the main muscles that are involved and moving around your scapula. And we've already learned the different parts of the scapula. We also have the back half, which I'm going to draw it right down here quickly. So right around here is where the infraglenoid tubercle is. This is the coronoid process. This is the superior border, and this is the subscapular fossa. We're going to later go into all the muscles that are going to attach at different points of the scapula. But just know the scapular region in general for the muscles, they include the deltoids, the supraspinatus, the infraspinatus, your teres minor and your teres major, your subscapularis, and your serratus anterior. And a way to remember your rotator cuff muscles, just remember your rotator. So your rotator cuff is going to be sits. Your supraspinatus, your infra, your teres minor. And these are all going to attach at the greater tubercle. And then what makes the S and sits is the subscapularis. And this is going to be attached to the lesser. Now in terms of your nerves, just know that the first two, so C and sits, is the suprascapular nerve, and the teres minor is going to be the axillary nerve. And these are all going to they're all a part of an anastomotic network. And an anastomotic network basically means that you have all the capillaries crashing into each other and dispersing into the tissue itself. So next we're going to look at how the blood flows. So an easy way, I kind of decided to look at it basically like a flow chart. So you have two main sources of blood that are going to come in. You have the subclavian artery and the axillary artery. The subclavian goes into the thoracodorsal. Sorry, the thoracocervical trunk. And we also break into the dorsal scapula artery. The thoracocervical trunk, we're going to find divides into the transverse cervical artery, and it also divides into the suprascapular artery. And that name should sound familiar because the suprascapular, we've already talked about it in terms of where it is on the scapula. So if we look back at the scapula, your suprascapula is right here. So you're going to have an artery that's going to feed the suprascapula and the infrascapular muscles. So we basically have the artery coming in through the notch and feeding into these two areas. So the transverse actually has two branches as well. It has the superficial, and this is going to feed your traps. Then you have the deep branch, and that's going to feed the rhomboids and the collateral shoulder circulation. Your subscapular is going to be, as I said, it's going to feed the supra and the infra, plus the collateral shoulder. And then the dorsal actually can go into two areas. The first is going to be the circumflex scapular artery, and these are all going to anastomose with each other. And now we're going to kind of break into a different direction. The axillary is going to go into the subscapular, artery, and it's going to go from there. It's going to divide into the circumflex and the thoracodorsal. And so anytime you see these double arrows or multiple sites going into one place, it usually means that there's going to be an anastomosis occurring. And so from the suprascapular, it's going to be from the third portion of the axillary. And so there are three branches of the axillary, so this is going to allow this split into the circumflex as well as the thoracodorsal. And so these are the main arterial circulation inside the scapula. And we're going to kind of get into the origins and insertions, but not too much. The reason being is just the way it's going to draw out. So in the caption section, I have provided a link so you can download my notes as well as the table to kind of help you memorize the different origins, insertions, the innervations, and whatnot. Another thing that is really important to learn is the different muscles, or the different spaces, I should say, for the names of the muscles within the within and around the scapula. So if we have the humerus right here, and we have part of our scapula coming out right here, and our clavicle coming out right along here, there's going to be different muscle groups that are going to come out, and there are different spaces or different spaces that are needed to be known. And so I'm going to draw a very crude drawing of what the muscles look like. And so we have our subscapularis right here, and then in this area right here you can imagine that there's the quadrangular space, and then we have two triangles that approach from there as well. One is the medial, the other is the lateral, and there's an easy way to remember this. So usually they're going to ask you the different triangles. And I want to make sure you guys have an easy way of knowing what they are without really having to memorize the guide or the table itself, or the muscles themselves, I should say. So what I've done is I've color coded it just so it's a little easier for you to know. And so all you gotta really know is where things fit on this diagram. So we're gonna have, as I said, the quadrangular is this square up here. Then we have our first triangle and our second triangle. As you can see, this area is more medial, this area is more lateral. So just know that your colors are going to go with whatever you see. So we have our first one, which is our teres major. And then right here we're going to have the triceps long head. The tricep lateral head. The surgical portion of the humerus neck. Subscapularis, and teres minor. Okay, so if we look at the quadrangular space, which is this one right here, we have the artery nerve available. From the superior, we see that it's the subscapularis, and there's also the capsule of the shoulder. From the inferior, we have the teres major, which we see is in green. And medially, we have the triceps long head, which is in blue. Then if we look laterally, we have the surgical neck of the humerus. Now when we go to our first triangle, we see the tricep long head, and this is the medial triangle. Up north, or in the superior, oh sorry, I meant to say this is the lateral one, not the medial. So we see the teres major, and then we see the tricep long head right here, or the lateral head. Same thing applies right here, where we have the long head, the teres minor, and the subscapularis on the medial triangle. And this is kind of an easy way of memorizing them, instead of trying to like break it down all the way. Now, since I kind of talked about it, you also need to know for the axillary nerve, it's going to feed the deltoids and the teres minor. The radial nerve is going to feed the triceps and posterior upper extremities. And that's basically it for your scapula. For the breast, I mean, there's not a whole lot there. Just know that it's a modified sweat gland. The ducts are lactiferous. It's one duct per lobule. Each are going to act separately at nipples. And then the connective tissue is a superficial fascia. And that's basically all you got to know. If you have any questions or comments, leave them below. If you like the video, give it a thumbs up. Please subscribe to the channel.